Hi, my name is Sabrina, and for my intervention presentation, I will be talking about an exercise that has to do with mindfulness, and then I will be demonstrating how that exercise can be used in your counseling groups. This technique that I'm going to be talking about is most beneficial at the beginning of group. It can be used multiple times, just the first several sessions, or maybe this is just something that you do on the very first session. In any case, in the initial part of the session, even before an icebreaker, this is a great way to just get groups started. We're all human. Before any therapy group starts, something had happened that day, that week, that month. Maybe a thought popped up and they're thinking to themselves, what do I want to share with this group today? What's going to be talked about? Why are all these other people here? What are they going to talk about? This is just a great way for people to build that connection to themselves, what their body language is telling them, and to be able to refocus their intention on what's important in their present. The more connected we are with ourselves, the more connected we can be with other group members, with our therapist, or just with other people in our lives. So this technique is not just used for members in group. It's something that, if practiced enough, they can take with them into their everyday lives. I'm going to demonstrate what this exercise can look like in your own group therapy sessions, but before I start, I just want to address a couple of points. So this script that I'll be reading from is one that I wrote by myself, but there are plenty of guided meditations and scripts that you can find on the internet, through YouTube, through podcasts, if that's not something that you feel very confident in creating by yourself. All right, let's begin. As I read this to you, wherever you are in the moment, I just want you to freeze, okay? And I want you to gently close your eyes and just start to focus on your breath. Whatever sounds that you have in your surrounding area, you can notice them and then let them fall to the side so that you may focus just strictly on your own breath. While you're breathing, I want you to breathe in through your nose and out through your mouth. And on your next inhale, I want you to breathe in for 4 counts. Hold it for 3. And release out your mouth for 4 counts. I want you to do that a couple of times. So we'll breathe in. Hold it. 3, 2, 1. And out. 4, 3, 2, 1. Let's do that one more time on your own. All right, now I just want you to keep that rhythm of breathing. And as you're listening to my voice without moving anything else, I just want you to bring awareness to your posture. I want you to slowly sit up straight in your chair. Allow your shoulders to release. Maybe you're tensing them up next to your ears. I want you to just let them fall to the sides. You can bring them up and around so that your chest is sticking out just ever so slightly. I want you to place your hands gently in your lap or just right over that armrest. I want you to raise your chin just a little bit so that you're sitting up nice and tall in your chair. Now I just want you to focus right back on that inhale and your exhale. Let you breathe in and out for a couple more times. Now I want you to bring awareness to your jaw. You might feel that your teeth are clenched. I just want you to loosen those up. Allow your tongue to disconnect from the roof of your mouth and just fall gently to the bottom of your jaw, right behind your teeth. And just keep breathing in and out. Now I just want you to notice if your feet are crossed out in front of you, or if you have one leg propped over the other. Just want you to gently place both feet on the ground and feel your body, how it's opening up to the world. You're sitting up nice and tall, you're taking up space, you're relaxed, you're focused on your breath. Now for this last part of the meditation, I just want you to place one hand to your heart and one hand on your belly. Focus on your breath and focus on the rise and fall of your chest and your belly. And just keep breathing. Any noises that are popping up, any thoughts that are coming to your mind, I just want you to allow yourself to observe them. Notice that they're there, and then let them go. And just come back to your breath. Come back to your hands, focused on your belly and your heart. You're breathing, you are alive. You are here. On your next inhale and exhale, I just want you to gently open your eyes and notice how differently you feel from before you started this practice. I hope that this short meditation was beneficial for you, but that you were able to feel that slight significance of being able to come back to this present moment and focus on the here and now. Something that's really beneficial for members after these meditations is to kind of show them, to teach them what that body language is expressing that they might not even be conscious of. Body language is a nonverbal communicator, so when we have our arms crossed, when we're hunched over and we're trying not to take up too much space, perhaps we are anxious, we're feeling vulnerable, we're feeling a little closed-minded. Maybe our posture is indicating that we're afraid, that we're sad, that we're tired. Oftentimes, people who are kind of closed inward, they don't want to take up too much space because they don't want to draw attention to themselves. Maybe their eye movements are a bit sporadic. They're looking all over the place because there's a lot going on in their mind, looking around a room, trying to observe and take in as much information as they can without taking up as much space as they can. All of these little indicators of our body language can be ways for us as a group leader to kind of take initiative to allow our group members to come back to a comfortable place within their bodies first, but then within the group. We don't always know what's going on in everybody else's head, but to run a little meditation like the one I just demonstrated, you can have a little bit more certainty as a group leader that your members are a little bit more relaxed. Maybe they're a little bit more open to receiving information because their body is open to receiving information. That connection is there. This exercise doesn't really have too many contraindications, except for a few things to keep in mind. This intervention should really be used with people who have an introspective ability. So for example, maybe children who are on the autism spectrum will not be able to participate in an intervention like this one. It's really important to think about the individuals that you're working with. So for example, if you're working with a trauma group, and let's say you want to include turning off the lights or allowing your members to lay down on the ground as part of their meditation. Those types of things can be triggering and can make members feel unsafe. So again, just some things to think about. Breathing exercises can bring up a lot of repressed emotions. So keeping that 3 to 5 minute mark is probably best for remaining in your realm of competence, but it's not exceeding any time into your session, but it's not too short where it doesn't really feel like much of an exercise to your members. Thank you for watching this presentation. I hope that you did gain some information, insight, maybe even a little bit deeper of a comfort while you were watching this, and that you were able to get something to bring into your own group therapy sessions. Bye!